Yeah, glad to be with you again from Unified OSCE. Without wasting your time in this video, the focus is on one of the evidence-based scenario, and we'll be looking at the cervical screening. We all know that CA of the cervix is one of the problems faced by women all over the world. So the allotted time for the session is 10 minutes. You'll be given a summary which is evidence-based, written by scholars. So they just pick up a summary of the research findings, and you have a scenario which you are expected to address a question or concern your patient has got. So you just use the summary of the evidence base, pick the point to address the concern. The allotted time is 10 minutes. So we have this scenario to use as a sample guide. You are the practice nurse in a medical center. A patient named Roshni, age 26, who is due for a cervical screening, has asked you, as a nurse, what will be the main cause of getting cervical cancer? She stated she does not see the need for it. She has only one boyfriend who she is sexually active exclusively with. Her friends also told her the procedure can be painful. So this has created fear in Rushni's heart. So we've got this article summary, research evidence base from scholars, a simplified summary of multiple research regarding cervical cancer, the causes, prevention, and treatment have been identified below. HPV, which is human papilloma virus, has been proposed as the first ever identified necessary cause of human cancer. Cervical cancer is still the second most common cancer affecting women worldwide, although it is theoretically preventable disease. Cervical cancer can develop between 10 and 20 years after an HPV infection. As a result, women's current sexual behavior may not always present her current risk. Cervical cancer is most common between the ages of 30 and 45, although it can affect anybody with a cervix, regardless of the age. Cervical screening is recommended for women every 3 years until the age of 49. Then, every 5 years. After the age of 49, it is advisable that you have a cervical screening every 5 years based on this research evidence. Women above the age of 65 will only be invited, after the age of 65, will only be invited if they previously obtained an abnormal result. So they will only be invited if they have an abnormal result previously. So that's the summary of the research evidence-based findings. Of course, you have your marking criteria. So it's a guide of the points you need to cover in your response. So we won't be doing much on that. And you'll be given a sheet where you have to write your response in bullet points. So this is a sample of my response if I'm addressing this. I started with a summary, which is not compulsory. The article pointed out the costs and importance of screening for all women. I will inform Roshni that the main cause of cervical cancer is human papilloma virus, HPV. I will inform Roshni that it can take between 10 and 20 years for cervical cancer to develop from an HPV infection. Therefore, a woman's current sexual behavior does not necessarily reflect a risk. I will explain to Roshni that the peak age for developing cervical cancer is 30 to 45 years, but it can occur to anyone who has a cervix, irrespective of their age. I will address any other fears or concern about screening with Roshni. In conclusion, I will advise Roshni that she should attend the screening every 3 years, of course, based on an informed decision. I'm not compelling her. And she has to do this until she turns 49, then to attend the screening every 5 years after the age of 49. Then women above age 65 will only need to do the screening if they have an abnormal previous result. And that's your evidence-based cervical screening scenario. It is a silent station. You don't need to talk to anyone. It's just your pen on paper. It's simple. All the best.